When we think about traditional pacemakers, we always think about a battery that's attached to a wire that's then connected into the heart. The new generation of pacemakers have eliminated the need for wires, which often were the weakest link in the process. The Micra is the first of its generational technology which allows for a pacemaker to be put in without any wires. This pacemaker has a battery life of almost 10 years and it allows for continuous pacing in a single chamber. The Micra is a significant development, particularly for patients who have problems with access into the veins. So if they have any obstruction in the veins in their arms, or they cannot use the veins in the arms for possibility of needing dialysis or other access points, this provides a true alternative for pacing capability for these patients.